Studio. I have four beautiful people with me in the studio, and they'll be talking about not money laundering now. They'll be talking about breast cancer awareness. Of course, the rate of breast cancer and its impact on human health is really, really debilitating, and they'll be giving us insight into that. They are all medical students from Igbinedion University, Okada, Nigeria's premier private university. I'd like to welcome Kenechukwu, right? And then, of course, I have Treasure and Onyinye and Ashiwaju. Thank you for coming on the program. I hope I got that correctly. Okay, so give us the background of this conversation. What is the action that you are taking to drive the message and drive the conversation on breast cancer awareness?
Okay, thank you very much, Mr. Jake, for that question. So
you need to project, talk more. I don't, because you're amongst ladies, your voice has gone. I mean, project, talk more.
Okay.
Yeah.
Globally, October 1st to 31st is regarded as Breast Cancer Awareness Month.
Okay.
So why this is very important? It has been stipulated by the World Health Organization that October is regarded as Breast Cancer Awareness Month. Why? Because it's important that we enlighten the public on the dangers of breast cancer, and also talk on the prevalence and incidence of this dangerous ailment, and because it's actually avoidable. It's an avoidable disease, but a lot of people do not know because lack of health education. And one of the major reasons why this month is regarded as Breast Cancer Awareness Month is to drive health education, to enlighten the public on the dangers, the prevalence, the incidence, the symptoms you can look out for. Those things that are very important for you to check out in your body as a woman. As much as breast cancer is generally for women, but a percentage of men can go down with it. Like let's say like less than 1% of men can go down with breast cancer. But majorly, it's a woman disease. You understand? So we are here to enlighten the public, to tell the public that, okay, this month is regarded as Breast Cancer Awareness Month. We are recognizing the people that are suffering from this disease, and as well as enlightening them on how to avert this illness, and if you already have it, on how to help yourself.
Okay, let me come to Inye. Where are you coming into this conversation? I mentioned it has to do with the predisposing factors responsible for breast cancer.
Okay. Yeah. First of all, I'd like to go into what the concept of breast cancer is. And breast cancer essentially is a malignant tumor that grows in the breast cells. And malignant in the sense that it is abnormal, it grows uncontrollably, and then it can spread to other parts of the body through like the blood vessels or the lymphatic system. It majorly occurs in the ducts that transmit milk to the nipples, or in the glands that do produce the milk, and rarely in the connective tissue and in the areolar tissues of the breast. And it can either be inherited genetically, or it can be acquired through different forms like radiation therapy. And essentially, breast cancer has been recorded as one of the most prevalent forms of cancer in women. After WHO's research in 2022 that was published in February of 2025, it showed that there were over 2.3 million cases, diagnosed cases of breast cancer in women, and over 680,000 or thereabout deaths that occurred from those breast cancer cases globally. And it will show that if current trends prevail, if there are no, factors, or if there's no constant aid being put in place to combat this breast cancer, it could exponentially skyrocket to about 3.2 million diagnosed cases in 2050, with about 1.something million deaths in women. And then in Nigeria, it was also shown that there were about 32,000 cases recorded in the year of 2025, with about 88 people being diagnosed daily with having breast cancer. So in this sense, breast cancer is not, as he mentioned, it is not a sign of death. Breast cancer is completely treatable. But the problem is that, especially in Nigeria and in other developing countries, there is a high rate of low detection. So essentially, if we're able to detect breast cancer at earlier stages, because most breast cancer cases get detected at stage 3 or stage 4, when treatment is just too late to be applied at that point. If there's any possible way we can apply, healthcare facilities, or even offer aid to women so that there could be earlier detection, there would be a significant decrease in the rate of women that have breast cancer.
Fantastic. Thank you, Inye. Let's come to you. What's your contribution to this conversation in terms of this awareness campaign?
Okay, thank you very much. So as my colleague Onye has said, breast cancer is not a death sentence. So there are people that are actually at risk of breast cancer. So some risk factors, I'm going to talk about them. Some risk factors for breast cancer include being a woman, number one.
Being a woman is
yes,
a predisposing factor.
It is a predisposing factor for breast cancer because women have breasts and they are the ones who will be affected by this. So another risk factor is age. With increasing age, actually, incidence of breast cancer increases. So in older women, we see more cases of breast cancer than in younger women for good reason, because with age, things are changing in the body and stuff like that. There's also something called the BRCA gene or BRCA gene. So there's BRCA gene 1 and BRCA gene 2. People, women or men with mutation in these genes actually come down with are found to have come down with breast cancer. So about, let's say, 80% of people who have mutations in the BRCA 1 and 2 genes will come down with breast cancer at age 80. So that's for the BRCA gene. Also, there's something called family history.
Okay.
So if a first-degree relative of a person has breast cancer, like a mother, daughter, sister, father has come down with breast cancer, there's a higher risk that that person also can come down with breast cancer. So symptoms of breast cancer are important to know because we are trying to raise awareness about this disease and combat it. Let it be seen at earlier stages so that it can be treated and it won't progress to a stage where it's basically turns into a death sentence. So symptoms include, firstly, a lump in the breast. Detection of a lump in the breast, that's the earliest symptom, and that's the symptom that most people commonly see that take them to the hospital to go and investigate for breast cancer. Another symptom is pain. So breast pain is into two types. It's classified into two types, cyclical and non-cyclical breast pain. So the one that we're concerned here with is non-cyclical breast pain, which means it's not related to the person's menstrual cycle. So a pain that comes and goes most likely is not breast cancer.
Okay.
But a pain that is there constantly is most likely related to breast cancer. Another symptom that should be looked out for is something called peau d'orange or orange peel appearance. That is a kind of dimpling in the appearance of the breast skin that is caused by retention of lymph fluid. And a complication of breast cancer, let me say, is seen in later stages of breast cancer. So another symptom is nipple changes. The breast has the areola and the nipple. So there can be changes in nipples, such as nipple retraction, dimpling of the nipple. There can also be presence of like rashes or scaling, anything noticed. So an important thing that people should do on their own before coming to the hospital it's called breast self-examination, where you just go in front of the mirror and check your breast for lumps, for all these things I mentioned, scaling, dimpling, peau d'orange, and all that. So that's my contribution. Thank you very much.
Now, we've heard the purpose of this awareness. We've also talked about what breast cancer is about, and then of course the risk factors which you mentioned. So how do we solve it? Because I think one of you said breast cancer is not a death sentence. If it's detected early, I'm sure it can be managed. That's why it's often said that prevention is better than cure. So let's get to hear from you, Treasure.
Thank you very much. It's important to note that breast cancer is very treatable, it's very curable, and that is why we encourage early detection, we encourage observing the changes in your breast. Men, women, observe the changes in your breast, and so you're familiar with the normal of the breast. So when you see an abnormal, it's easy to identify it and report to a healthcare professional to get it checked. So breast cancer is very much curable, it's not a death sentence, and it is not fatal, especially if detected early. So it's important to go for regular screenings and to check your breasts very frequently.
Okay.
I'd also like to highlight some misconceptions. some myths, some things that are not true. We frequently hear about breast cancer, but they are not exactly true. One of that would be breast cancer. If you have it in your family, if there's a family history of breast cancer, means you're going to have breast cancer. The risk is higher with family history, but it's not absolute. You're not going to get breast cancer because somebody in your family has breast cancer. But it's important to always check your breast for breast cancer. If you find a lump in your breast, it is not always cancerous, but it's important to get it checked. And it doesn't always present as a lump. It's usually commonly seen as a lump, but it's not always a lump. It could be changes in your nipples, it could be nipple discharge, changes in your areola, dimpling, skin around the breast, and other things. And breast cancer doesn't only occur in older women. That's a very common misconception. Young girls too, you're still at risk of breast cancer. So it's important to get familiar with your breast and frequently check for any changes in your breast. It is also common, people believe that a healthy lifestyle would prevent breast cancer, but that's also a misconception, as you can live a very healthy lifestyle and still be predisposed to breast cancer. All in all, it's important to check frequently using self-breast examination, like I'm going to show shortly. It's important to check your breast and observe changes, get a mammography, and see your healthcare professional if you observe anything wrong around your breast areas.
Okay, I've heard a very robust contributions from all of you, but I haven't heard anything about how you can tackle breast cancer using vaccine, which is something that is very topical and has been part of the conversation. But there are criticisms about the use of vaccines, which some say there are structures and strategies to for birth control, and of course all of those stuff. I don't know if anybody wants to say something in that direction.
For vaccination,
Yes.
One major misconception people have recently from the coronavirus era is that vaccination is dangerous. Is conventionally say is the mark of the beast, 666, you understand? But as healthcare professionals, I mean, we are coming from a scientific aspect. For any disease that has a corresponding vaccination to prevent it, we cannot tell someone that this is not right. Vaccination is very important for diseases that have corresponding vaccinations, like cervical cancer, HPV, all this, they should be vaccinated. So this is part of the awareness we're creating, to let the people know, okay, that for diseases that have corresponding vaccination prevention, you should have it.
Okay. Yes.
I would also like to say that this brings us back to what I was saying about breast cancer being very prevalent in developing countries.
Yeah.
That vaccine is not easily accessible, readily accessible to people in developing countries like.
And that's a challenge.
Yes.
Okay.
Hence why we put emphasis on early detection.
Okay.
If in the future we're praying that there would be easy accessibility to this vaccine all over the world, but as at the moment stands, that vaccine is not readily available in developing countries. So the steps we can take to mitigate the prevalence of breast cancer would be early detection.
All right, fantastic. Apart from this, is there any program of activity lined up for this week's observation of World Cancer Day?
Yes, okay. After this, not after this, but part of the program,
of it, okay.
She's going to be illustrating breast self-examination.
Okay, so how are you going to do that? Okay, we have a video actually, right?
Yes.
We have a video we're going to show to you right now. That video will cap up this conversation before we link you to Abuja Network Studio, where Joseph is already on standby. Joseph, you should be interested in this conversation, so you just be on standby and watch this demonstration. Okay, but let's take a look at the video, and then of course you give us a background information on how we can prevent breast cancer, the steps to follow, and the actions to take. Let's go. Okay, so let's see. Yeah.
When do you check? Do you carry out a self-breast examination? Like you said, self-breast examination. So you're carrying it out on yourself. as a man, as a woman, women especially, because the prevalence rate is higher in women, you carry it out days after your period, because during your period you tend to experience tenderness of the breast. You carry out your breast examination, preferably when you're taking a shower in the bathroom, when your skin is slippery. You make use of your fingertips and you move in a clockwise direction, and you move in a clockwise direction. You use your right hand to examine your left breast, and you use your left hand to examine your right breast, and you move clockwise, and you're checking for any tough tissue, any hardening. You're checking for any skin changes. You're checking for lumps. You move into your armpit as well, and you feel for any lumps, any changes in that direction, because the breast extends somewhat into the armpit as well. And you raise your both hands up. You check the sizes of the breast, check the shape. Do they look any different? Is there any dimpling in the skin of the breast? And this should be done once a month. It's important to just have a specific date every month to check your breast, especially in women. And when you do this, you're familiar with what's normal in your breast, and it's very easy to observe when something is off with the breast and for you to see a healthcare professional.
Fantastic. We've been talking about breast cancer awareness, and the statistics are there, which makes it very, very disturbing and needs everybody's action for everyone to be involved. Even if you're a male or you're a female, we all have to be involved, because if you're a male, you are somebody's, you have a sister, you have a mother, you probably have a grandmother, you have an auntie, you have someone in that regard. And I think it was Shiwaju who said that one of the risk factors is that once you're a female, that's number one risk factor. And so that makes the conversation very, very serious, that needs everybody's attention, just to ensure that we get it right. And then, of course, we reduce the incidence of breast cancer. As it stands at the moment, there's also a feeling that perhaps it is more within the ambit of the African continent. Is that correct?
Yes.
So talk to us about that. Yeah.
Okay. By statistics, 60 to 80% of sub-Saharan African patients that present with breast cancer, they are already presenting at an advanced or metastatized stage. Because there are stages to breast cancer. When you're using the CMN stage, there's stage 1, stage 0, 1, 2, 3, 4, 5. Now, people that present in sub-Saharan setting, they always present, majorly 60 to 80% present when it's already cancerous, when it's already metastasized from the breast to other tissues. And why is it that way? One, poor health education. A lot of people don't know. If you don't tell them, how would they know? That is why we are doing this. So health education is very important. And aside that, in these parts of the health education, social stigma and cultural barriers. Now, stigma of people think that once you have a lump in your breast, you are going to get a mastectomy. That is completely cutting out the breast. No, it doesn't mean. A lot of people have that conception in their head. So they rather keep that lump to themselves and preserve their breast while dying inside. So when it's now bad, they won't have a choice than to present to the hospital. And then it's late. And that same breast they're trying to preserve will still be cut. You understand? So that's why
could even lead to death. Yeah.
So that's why we need this health education to enlighten the public, to tell them, okay, these are the dangers of this. You presenting in the hospital on time doesn't mean that you're going to get the breast cuts. And since breast, the organ we're talking of, is a cosmetic organ, a lot of women, I mean, if I'm a woman, I wouldn't like my breast to be cut. You understand? So it's understandable. But at the same time, it's very important to get yourself checked and to present on time. That's why we hammer on detection. And if you're comparing developing countries and underdeveloping countries like Nigeria, then you come to find out that in developing countries, they have higher incidence, but in underdeveloping countries, there are higher mortality rates. Now, in developed countries, US and UK, there are higher incidence number of people. Why? Because the lifestyle there it's suggestive. It also promotes this cancer. But here, aside lifestyle, we have low incidence and higher mortality. And that low incidence doesn't necessarily mean that they're low incidence, just as we don't know. They have not been checked. If you are going into public health, you talk about the iceberg phenomenon. The number of people that have been detected are less than the number of people that have the disease.
Okay.
Do you understand? So
Yeah.
that is why we need to hammer on this. We need to enlighten the public that it's necessary to get yourself checked.
Okay. I've heard people say that, oh, they throw the thing, give me. No, I mean, we need African, you know, say
African
the-
setting.
Yes, yes.
That is part of the cultural belief and the whole things we talk about.
Okay.
Breast cancer is not a village people. I don't know how they do it, but your village person cannot give you breast cancer. Breast cancer is a biological disease. So this is part of a misconception we need to break down in our setting. Because you can, if you go to a village and tell them, okay, breast cancer, they say, no, now my family member, I know the person with drum. But this is illiteracy, ignorance. If you don't enlighten them often, they will know. They'll keep on believing that it's someone at the backyard that is doing them.
Yeah.
But they will know it's that either the gene or the lifestyle or family history.
Okay.
You understand? That's why it's important. Health education is paramount.
Okay. I mean, you just talked something. You said something about the fact that in developed countries you have higher incidence. In underdeveloped and developing countries you have higher mortality rates. What is the major reason why we're having this disparity? Is it connected to the food we eat? Let me get your take on that one here.
It's actually the accessibility to healthcare.
Okay.
As Treasure mentioned, breast cancer is not limited to your hygiene, it's not limited to your diet. A perfectly healthy person can get breast cancer. You can just be existing and have breast cancer. So it doesn't really have much to do with you as a person. Sometimes there are idiopathic causes of breast cancer. At the end of the day, the reason why developed countries have lower mortality rates is because of the accessibility to healthcare. The fact that they can go to the hospital, detect it early, and receive treatment, non-surgical treatment.
Okay.
And we are not accessible to that in developing countries.
Okay. Let me just ask, we've seen that because of the aesthetic nature of breast, we have a lot of ladies who are doing breast implants, doing plastic surgery, and all of these things. What do you make of these, Asiwaju?
Hello, so thank you very much.
Yeah.
I feel like the breast implants that people get is actually a very good cosmetic, is of good cosmetic relevance, especially in breast cancer, where people have had mastectomies. So it's also part of, mastectomy means a removal of the breast after, let's say, breast cancer, for example. So it's also part of, she was mentioning stigma earlier. It's also a way to reduce the stigma that, oh, your breast has been cut off, but you can actually have an implant to be put in so that, outside it's not obvious that you've had your breast cut off.
Okay.
But if you're talking about whether implants are actually related to the
the
cause
disease,
of, breast
itself.
cancer, so I don't think we have much research on that.
Okay.
If implants are related to breast cancer, but how they are related to breast cancer is helping the cosmetic appearance of people who have actually had mastectomies.
Okay. You want to add something to that?
I was going to add to say that there's no definite research that concludes breast implants are related to breast cancer. Alongside, you have to say deodorants, like your antiperspirants, they contribute to the formation of lumps, and there's no research that proves that.
Okay. So, on a final note, what's the first step to take when you notice these predisposing factors that we've highlighted so far? What's the first step to take?
The first step to take when you notice by detection is go to the hospital, meet a healthcare professional.
Okay. So don't try to put rub on it, or try to put.
Also, now you mentioned, people are gravitate towards traditional medicine more than synthetic medicine. I mean, I'm speaking from, I'm a medical student.
Okay.
No, it's wrong.
Okay.
Many people want to go to their baba or their village, whatever, to go and get this drink a bowl that will cure breast cancer. And it keeps on progressing. So the first thing you do is go to the hospital.
Yes. And what?
And have them stage it, so you know what stage of the breast cancer it's at.
Okay. I think from this conversation, something that you guys highlighted, which is the fact that most times people try to get help at the advanced stage of breast cancer. At that time, it's practically impossible to a large extent to reverse the process. But if it is detected early, you can get remedy. That's the parting shot from this conversation. Thank you very much for your time with us on the program.